Health coaching really is to provide patients with the knowledge, the skills, and the confidence to become informed and active participants in their own care. Now, a lot of people feel like knowledge is enough. If people have knowledge, they'll be able to help themselves with their health. It turns out that knowledge is not enough. Skills now are very dependent on which chronic disease they have. So there's different skills for diabetes, for pulmonary disease, and so forth. But the confidence is very, very important. And we know very well, and Kate Lorig taught me this, that if you're confident you can do something, you can probably do it. And if you're not confident you can do something, you probably cannot do it.
So the health coaching model was based more on a motivational interviewing approach and goal-setting approach, which was to start by asking the patient, what are your goals? What do you want to achieve? What do you think you could change? And then start with small steps that patients identified as realistic ways to begin to change their behavior. A simple change in the diet that they actually think they could realistically do, that'd be a first step forward. A simple thing, getting off the bus one stop before work so that they could begin to walk. So it was both the method and then engaging the whole healthcare team to start to participate in this health coaching approach.
I feel that communication with patients is just so critical to the work that we do. The skills that one learns being a health coach or working with a health coach really have to do with communication and active listening and working with patients to make the changes that they're able to make, and then encouraging them in the changes that they do make so that they can promote their own health.
So my relationship to health coaching as a primary care provider they're one and the same. And so in particular, working with underserved populations, people who've been marginalized by the healthcare system, in the past, I think in particular, health coaching is an incredibly powerful tool as a primary care provider that I use on a day-to-day basis. Health coaching is related to patient-centered care in really understanding where patients are and the barriers they face. So for example, it might be, understanding, issues around gender, issues around, recreational drug use, issues around exchange of sex for, particular goods or something like that. But really, I think figuring out where people are and going from there.
So why do we need health coaching? Well, we're not doing very well with people with chronic disease. So for example, about 50% of people leave the clinical office visit without knowing what the clinician said, what they were supposed to do when they leave. That's really a major problem, and health coaching with what we call closing the loop can really address that problem. We also know that only about 10% of people are involved in decisions about their health, and we also know that when people are involved in decisions about their health, their outcomes are better. So a lot of what we do is working on shared decision-making with patients. And then finally, about 2/3 of people don't take their medications as prescribed. And our health coaching program does a lot of work with strategies to improve medication adherence to try to address that problem. So health coaching really can help chronic disease outcomes. So who can be a health coach? There are actually jobs that are called health coaches, but really health coaching is not, in addition to being a job, health coaching is a function, and everyone should be a health coach. Doctors, nurses, pharmacists, social workers, medical assistants, everyone should be a health coach as part of what they do when they're taking care of patients.
Aside from communication, which I think is such a critical part of what we do in healthcare, I think it's also about learning how to listen to our patients, how to hear what their experiences are, different from ours, sometimes similar to ours, but oftentimes different from ours, how to hear from them, how they're prioritizing their healthcare, where it falls on the dozens, if not hundreds of things that they're concerned about in their day-to-day life. How patients feel about medications and how patients feel about chronic illness and how patients feel about their sense of how well they are. Like, am I a healthy person if I have diabetes? Well, the answer might be yes, right? And so I think just hearing from our patients what their fears are, what their priorities are, I think it's one of the things that really has helped me to understand patients that are from different cultures than I am, that have different languages, that maybe speak the same language, but are from completely different family dynamics than where I grew up. And to really understand that sometimes the health disparities that we hear so much about, and in order to achieve health equity, we need to really understand and listen to our patients actively and work with them to make the changes that are going to have us have a more equitable healthcare system.
So health coaching has impacted the quality of care I provide my patients in so many ways. In particular, working with underserved populations, I think it's really important in how I build relationships with patients, understand what challenges and barriers they face to reaching their goals, as well as helping them identify the strengths they have to be able to reach those goals. And I think in particular, off the top of my head, thinking about people living with HIV and a population that I work with, health coaching really helps to build that rapport, understand those barriers, and really figure out how we can work together to get them where they want to be. Health coaching benefits primary care at large, I think, at all levels, and is incredibly important to the foundation of primary care. Particularly, as an example, with complex care patients who require, additional support, health coaching really helps us understand where the levers are in care that we can really, make a difference in the patients that we're seeing. So, for example, it might be understanding, why a patient doesn't want to take a particular medication, or why a patient, is resistant to going into another particular health care environment, or really understanding, what their experience has been in the past with providers, and trying to understand how we can move beyond that and really work with them to get them to the care that they need.
One element of my work that I find very challenging to do without health coaching skills is delivering patient education. I think it's very common during patient education to talk at the patient and to have the patient just receive that education, where I feel like it would be more effective and efficient if we used communication skills from health coaching that allow more bi-directional communication. So those skills include asking the patients to assess their current knowledge and understanding. Another skill would be the ask, tell, ask method. And then another important skill would be the teach back method to help us understand and assess what the patient has learned already.
Health coaching really represents a whole shift in how we have to start working in partnership with patients. And one of the key elements of health coaching is patients helping to define their goals for their health. Now, in health coaching, we tend to think of it as, okay, define your goal for a behavior change. Nutrition, exercise, smoking, your medications, what have you. But goal setting really has a much broader application. It's something we should be doing with patients in all aspects of their health care. What are your goals now that you have cancer? Is it to prolong life at any cost, or is it to optimize quality of life for what time you have? What are your goals as somebody who's aging and beginning to maybe get dementia, and to think with your family, what are your goals for your quality of life and what you are looking for with your health care? And it's very clear to me when I work with students, with residents, with other physicians and nurses, that that's not the dominant way that we were taught. We were taught to sort of, there's a diagnosis, you make the diagnosis, you then recommend a treatment, and we miss the step of saying, well, how does this fit in with what you want for your overall health? And how do we really think about matching what we can offer with what your goals are? So I think health coaching is really a critical paradigm shift for healthcare overall.